Hey there, today we are going to delve into the fascinating world of ophthalmology as we explore the science behind the conjunctivitis, commonly known as pink eyes, and how we can prevent it. Let's dive right in. What is conjunctivitis? First things first, what exactly is conjunctivitis? Conjunctivitis is the inflammation of the conjunctiva, the thin clear tissue that covers the white part of our eyes and the inner surface of our eyelids. It can be caused by various factors such as viruses, bacteria, allergens and irritants. Types of conjunctivitis. There are several types of conjunctivitis, each with its own underlying causes. Number 1, viral conjunctivitis. And this type is highly contagious and it's often associated with the common cold or respiratory infection. It's usually characterized by water discharge and can affect one or both eyes. Number 2, bacterial conjunctivitis caused by bacteria, and this form of conjunctivitis also tends to highly contagious. Symptoms may include thick yellow or greenish discharge and redness in the eyes. Number 3, allergic conjunctivitis triggered by allergens like pollen, dust or pet dander. This type is not contagious. Itchy, watery eyes are typical symptoms along with redness and swelling. Number 4, irritant conjunctivitis. Exposure to irritants such as smoke, chemicals or foreign objects can leads to this type of conjunctivitis, and it is usually affects both eyes and causes discomfort, but it's not contagious. Now let's dive deeper into the science behind the conjunctivitis. Number 1, viral conjunctivitis. Viral conjunctivitis is often caused by the same viruses that leads to the common cold or flu, and the virus enters the eyes through the contact with contaminated hands or droplets from cough and sneezes. Number 2, bacterial conjunctivitis. Bacterial conjunctivitis is caused by various types of bacteria, and these bacteria can be transmitted through direct contact with an infected person's eyes, discharge or contaminated surfaces. Number 3, allergic conjunctivitis. Allergic conjunctivitis occurs when the immune system overreacts to allergens. The body releases histamines leading to the inflammation and irritations of the conjunctiva. Number 4, irritant conjunctivitis. Irritant conjunctivitis is caused by the physical or chemical irritants coming into the contact with the eye's surface. While conjunctivitis can be uncomfortable, the good news is that we can take steps to prevent its occurrence. Number 1, practice good hygiene regularly. Wash your hands with soaps and water, especially after touching your faces or coming into the contact with someone who has conjunctivitis. Number 2, avoid touching your eyes. Refrain from touching or rubbing your eyes, as this can introduce bacteria and viruses. Number 3, personal items and makeups. Avoid sharing personal items like towels, eyes drops and makeups, as this can be potential sources of infection. Number 4, protective eyewears. If you work in environment with airborne irritants or chemicals, use protective eyewears to prevent irritation. Number 5, allergens management. Manage allergens in your environment by regularly cleaning surfaces, using air purifiers and keeping windows closed during high pollen regions. And there you have it, the science behind the conjunctivitis and some practical tips to prevent it. Remember, your eyes are precious, so taking care of them should always be a priority. If you experience a persistent eye redness, irritations or vision changes, be sure to consult an eye care professional. Thank you for watching and stay curious.